Well, I think that everyone on the team, the BOCC, our public health board and all the staff, this particular board, and our community all needs to be very proud of the hard work, because it takes every one of us working hard to make this happen. So, and I'm looking to see if I have quorum yet. Hi, Jeannie, good to see you. I see Kim Levin's name, but she'll be back. Okay, 1, 2. Hi there, Kim. Do we have quorum, Karen? Yes, we do. So let's go ahead and get started. And it's good to see everyone today. And thank you, Greg, for filling in the chair for me, because you might have to do it more than once over the next few months after another shoulder surgery last week.
My pleasure, Marky. I'm glad to see you smiling today.
Well, I decided to take off my wing today, even though, just don't tell anyone instead that Marky has her wing off. But let's go ahead, let's get started. And with that, I'm calling the meeting to order. And I know we have a pretty aggressive agenda today. I'd like to know if you would like to do any additions to the agenda or any changes. And if you're fine with the agenda, can I have a thumbs up? Looking around. Okay, well, we're going to go with it. And next agenda item are the approval of the previous minutes. And since I did not attend, I listened, but I did not attend in person, I cannot make a motion to approve. So I'll ask one of you to do so. Thank you.
I'll move that we approve the previous minutes.
Thank you very much.
I'll second it.
Okay, the second was Jeannie. Okay, thank you. All in support, thumbs up. Okay, let's move on. This is what I call one of the most interesting parts of this entire agenda, and this is all the data that's coming in. And there's a lot of moving parts. It's wonderful every night to get a report from Josh and team. And with that said, let's go ahead and Karen, you want to take the lead here?
I just get to take the lead, and I'm going to start with honoring Charlie, who had his last day with us last week, who usually got to join Kim in this this space of sharing data. So we've formally transitioned over to Josh taking that role, but I have to tell a joke that Charlie shared with us last week. Hopefully it's okay. So he said three epidemiologists walked into a bar. Oh wait, epidemiologists would never do that. That was Charlie's joke. So I wanted to share that with you to start the meeting. But I'll turn it over to Josh and Kim now.
Oh, Josh, are you there?
He's been having some major problems. No, we can't hear you, Josh. Okay, Kim can go first.
Okay,
Sorry,
I'll
Kim.
go first, no problem.
We're delegating. Okay, Kim, good to see you.
Nice to see everyone. Yeah, Lindsay, if you want to just scroll down to my slides.
Hi, Kim.
And I'll be presenting.
Raleigh, our admin assistant, will be taking over the technology side. So we're just troubleshooting over here, but we'll bring up your presentation.
Okay, no problem. Okay, I hope everyone can hear me okay. So I usually go after Josh, but so I'm just presenting the AVH, the Aspen Valley Hospital data, and everything is looking very good. Start off with the matrix, which you all see on the dashboard, and we're in the comfortable phase, as we have been, for inpatient hospitalizations for the daily visits and healthcare workers. Next slide. Thank you. So for inpatient, this is number of inpatients, and we're well below the 8 that take us from the comfortable to the cautious phase. And in fact, we've been 0 to 1 since June now. So I also want to remind everyone that we have had 6 transfers out since then. So transfers are people sicker than we would take care of here. So we've had kind of sick of the highest acuity that got transferred out, and then 0 to 1 for the past couple months. Next slide. And then emergency department visits, and we look at 6 a day for COVID-like symptoms as our cutoff between the comfortable and the cautious. We were above that, kind of dipped above that and close to that in during July. And then in August, we've gone down, which is promising. It looks like just recently in the past 14 days, we started having a few more coming up, but not crossing that threshold. Next slide. And the Respiratory Evaluation Center, which you all know is the center for COVID-like symptoms to see a doctor and get a test. And there was a spike kind of at the end of June for that. And in terms of the tests, we've been below our cutoff of 10 fairly comfortably, kind of right in the middle since then. Next slide. And then this is the community COVID test. So this is where you referred to get a test at AVH for COVID-like symptoms, but not see a physician visit. And this is what put us initially in July over that comfortable phase into the cautious. We're in the yellow zone where we were in July for the matrix. And since then, we've dipped below the 16 a day that we've been doing. But as you can see, we did go above it for one of those days recently at the end of August. And we're just kind of hovering right below, a little bit lower, and we'll see what happens in September. Next slide. And employees that are out with COVID-like symptoms, we did have a spike in July again, and now we're low, we're well below 6, cut off at 0. Next slide. And then this is just a weekly positive and negative PCR test results of all the testing that we do. So the inpatient in the emergency department, the respiratory evaluation center, and all the asymptomatic testing as well for preoperative testing that's done. And so the number of tests of kind of overall testing has kind of leveled off since mid-July, where we really did have a spike. And as you can see, the rate of negatives, the rate of positives are going down. And if you look on our website, our 14-day positivity rate is under 2% now, which is really great. Next slide. I just have a couple slides here I'm going to add in, and then Josh, you can continue on. And as we move into the fall season, and there's a lot of conversation about influenza and other illnesses, and I just want to remind everyone that routine vaccination, this is from the CDC, routine vaccination is an essential preventive care service for children, adolescents, and adults, including pregnant women, that should not be delayed because of COVID-19 pandemic. We're really, really urging everybody to go to their doctor to get the flu test and to get up on your pneumococcal vaccines and to vaccinate children on their routine schedule. Next slide. Again, the really 3 that are important to continue doing throughout the COVID-19 pandemic, which are the upper respiratory diseases that are also spread by coughing or sneezing droplets, is influenza, pneumococcal, and the DTaP, which includes tetanus, diphtheria, and pertussis. And it can potentially reduce the burden of the diseases and COVID-19 morbidity and mortality. They may just really work together. And all the prevention practices, physical distancing, respiratory hand hygiene, mask wearing, all of that will hopefully help to reduce these, and influenza in particular. Next slide. Just some numbers from the CDC from, if we look at the season before, so the 2019 to 2020 season, just reminding everybody that the flu really has a significant burden. 24 to 62,000 flu deaths, the number of hospitalizations, and medical visits, and just the impact that flu alone has. So again, to really look into talking to your doctor about getting a flu vaccine this year. Next slide. And then this is Colorado data from last year on influenza, and it starts rising in, I guess a little bit of the bottom's cut off. It's October, November, it really starts rising. The yellow is, the blue is A and the yellow is B, and it just looking at that curve from last year and the number of positive tests. And now we're so used to looking at these these graphs with COVID-19, and we kind of forget that we've been doing this all along with other diseases such as influenza. Next slide. And then pediatric deaths from influenza in Colorado over the different flu seasons. The last one, 18-19, there were 3 deaths. Next slide. And my last slide here is also to remind everyone that there was a pertussis epidemic in Colorado in 2012 to 2016, when the epidemic, the red on the top, the epidemic average was around 100 cases, and the 5-year average below that was a lot lower. And really that these cases start rising in September, October, November, which we will expect as well. So getting that DTaP vaccines, your children vaccinated and up to date for adults as well is incredibly important. And I think that's it for me.
Okay, can y'all hear me this time? Okay, perfect. Thanks, Lindsay. Perfect. Kind of leading off of what I did a few weeks ago, looking at different countries and how they are handling the pandemic, I want to quickly just discuss Syria and what they're experiencing. So on the top left, you'll notice their epidemic curve. That looks quite different from ours. You'll see that there was just very few case counts from March until about June or July, really. And we know that they did not have access to widespread testing. And so we know that they were just missing a ton of cases back then. More recently, they've begun to get a little bit more testing, but you'll notice that case counts per day are still extremely low in Syria. And of course, with the humanitarian crisis that they're facing, you know, they're having devastating effects from the COVID-19 pandemic. I took a quote from the UN Assistant Secretary General for Humanitarian Affairs, and he was talking about one of the Syrian refugee camps there, Al-Hol camp in northeast Syria, where they have 65,000 individuals, mainly women and children. And in that camp, 12 of their healthcare facilities had to suspend operations this month because they had too many staff that were infected, either with COVID, other diseases, or they had to isolate. And they also just have severe lack of personal protective equipment. So in that one camp there, they are just facing just unprecedented challenges there. And then another quote from the Middle East Institute noted that as the bodies pile up, it remains to be seen how a nearly broken country can get through this pandemic without some form of serious international medical support. I mean, they're just really, really struggling to not just test people, but to also care for people that need medical care. And then another interesting table that I threw in here, right in the middle, looks at their exposure sources. And you'll see that very first one, 2,522 of their cases had an unknown source of infection. So their community spread numbers are just extremely high. They're through the roof. And so, you know, they're just not able to connect cases back to each other, which means they have way more cases than they're accounting for. And then that bottom right picture, they had 4 of their hospitals recently bombed, which, of course, just, you know, led to, you know, even further challenges in trying to get people to access care. So overall, I mean, you know, Syria is just really facing a lot of challenges when it comes to the COVID-19 pandemic on top of what they're already facing. So I just wanted to highlight just the challenges that other countries around the world, especially Syria, are having in trying to combat this pandemic, and really just interface that with how different it is here in the United States, and, you know, how just how lucky we are to have the resources we have, but also recognizing just how desperate and challenging circumstances are in other countries. Next slide, Lindsay. And touching off what Kim had discussed, I wanted to show this chart. This is what they're experiencing in the Southern Hemisphere in regard to influenza. So the orange bars there, that's influenza A. The bluish teal bars, that's influenza B. And so you'll notice that this is what they saw last year. The weeks down here are just weeks per year. So for example, week 1 is January, week 5 is February, and so on. So this was, you know, the summer going into the winter right here. And you'll notice that the number of specimens that were coming back positive in the sentinel sites that are used by the WHO. They had a peak right around here, close to 900 cases that were reported to them. Obviously, there's way more. This is just what was reported from the lab. And then, of course, their flu season, ended, and then ours began in the Northern Hemisphere. So then they saw a little bit of a spike here when COVID began to emerge. And then, you just look what happened. All summer, they've had extremely low case counts of influenza. In Australia, there was 1 week where they reported a handful. It was like 8 cases out of 30-something thousand tests that were done. So they're just seeing extremely, extremely low counts of influenza. We have our fingers crossed that trend will hold true for us here in the Northern Hemisphere. But if it's anything like the Southern Hemisphere, I think we're going to have a pretty inactive flu season, which is exactly what we want. I think back a few months ago, we were extremely concerned about what is it going to look like when we have COVID and flu co-circulating. And so if these counts stay low, I think that's going to be extremely good news especially for our hospitals, but also for our vulnerable populations. So I just want to take a second to share that, and glad that Kim had provided the foundation to discuss influenza. Next slide, Lindsay. So now looking at Picken County specific data, this is our epi curve back through March. I included the positivity rate in there just to show, just the impact that testing has, and how far we've come with testing. We had a 60% positivity rate back in the end of March. And then, since then have just been able to keep our positivity rate very low. And that's thanks to the hospital and all of our providers for providing testing to those who need it. And you'll notice more recently, our positivity rate has dropped, as Kim mentioned, much lower, down to 2 and 3%. So we have seen a decline in our positivity rate as well as our case counts. We're hoping that trend continues, but we also recognize that we have Labor Day and many other events coming up that will likely increase our case counts going forward. Next slide. So then just to touch on a few things about our data, there's not too much to discuss since we haven't had too many cases, but I wanted to show just some data on our out of jurisdiction cases. So the pie chart on the left are our out of jurisdiction cases since July 9th, and then the pie chart on the right are the out of jurisdiction cases since August 1st. And so what we've really noticed is that the trends have actually remained quite similar. Eagle County and Garfield County are they're making up about 40% of our out of jurisdiction cases, and the rest of them are coming from out of state travel. We're seeing a lot of the same kinds of states pop up. Michigan has popped up a few times. California, Florida, those are kind of the main players where we're seeing cases imported from. So not too much more to say on this other than to note that, we're still seeing out of jurisdiction cases come in. They're not the majority, but they're definitely something that is noteworthy and something we're keeping an eye on going forward. Next slide. And then, I really wanted to just take a second to talk about our contact tracing team. We have 6 individuals that have been hired on. And I just want to quickly thank them for all their extremely hard work. They're a great team. They're all extremely invested in understanding COVID and the dynamics at play. They're also extremely invested in equity. We have discussions every morning over equity and how we can create a more equitable system, and how we can ensure that at the health department through contact tracing case investigation, we are ensuring that there's equity in those discussions and in the interviews we do. So they're just an extremely wonderful team of individuals, extremely patient on the phone, and they've just done a great job, right? They came into this pandemic about a month and a half ago, and a lot of them didn't have any background in COVID, but they've all just really taken it to heart, taken it seriously, learned a lot about COVID, and are just really excited about the opportunities that they have to really support the community in this way. So I just wanted to give that shout out and let the Board of Health know just how great that team is. I want to show some data as well with our contact tracing. So this chart on the top left here, this is the number of contacts we've had, so number of exposed individuals per day. So you'll notice that it mirrors what we see with our epi curve, where we saw a spike right here at the end of July, early August, and then we've really seen it kind of peter off since then. But this also mimics the number of interviews that are done. So over here on the right-hand side is the number of interviews that were done per day by our contact tracing team. So notice that in early August, we had our contact tracing team do 47 interviews in one day. The other night, our team stayed up until 9 o'clock. They worked way past their hours to make sure that people were contacted and they could be informed of their exposure. So again, this team just goes above and beyond, and I'm just really grateful for them and thankful for their work, and I hope the community is as well. And then last thing about this is down here, this is the number of quarantined symptomatic contacts. So the number of people that we've asked to quarantine because they were exposed, this is a number that developed symptoms. So we've had 60 developed symptoms since July, and that's 15%. Which is what we see in the attack rate. We know that about 15% of people that are exposed to COVID will go on to potentially develop symptoms. So that mirrors what we see in other research as well. And then the last thing here is just the age breakdown of our contacts. So I have since July 1st and then since August 1st. Green shows an increase, red shows a decrease where we sit right now. So you'll notice that overall there's an increase in the number of exposures among those who are younger. And then there's a decrease in the amount of exposures amongst those who are between the ages of 31 to 65. And then those who are over 65, it's about the same. It's not very statistically different there. But just wanted to point out that we are still seeing that trend of younger individuals who are testing positive more often, but also they are potentially exposing those who are younger as well. Next slide. And then, really the last thing about our data is to look at our cases among the Hispanic and Latinx community. I brought this up last month when we really saw a spike in cases among this community. And I wanted to show that as of right now, as of today, when we pulled this data, the trend has changed. So we've begun to see less individuals in the Hispanic and Latinx community who are testing positive. And it's swapped, and it's a little bit more consistent with what our population and census data looks like. So we've really kind of taken that case count and flipped it on its head for, I think there's a lot of reasons why that happened. But I think it's a good sign that we're seeing that, potentially this community may not be experiencing as many effects from COVID or fewer exposures from COVID as we were seeing last month. Next slide. And then I just wanted to share two last slides, and Dr. Levin might want to potentially add in some thoughts here, but these came from the Colorado School of Public Health, and they did some modeling to show us, what they're estimating the reproductive number to be, the R0, as well as some other data, which is forward-looking to try to understand what the curve might look like going into the winter season. And so this modeling here is showing the reproductive number. So really we want this to be below 1. If it's below 1, it means our case counts are decreasing. As it approaches above 1, it means that our case counts will continue to increase more so exponentially. So what we're seeing as of about mid-August is that the reproductive number has stayed below 1. So it's fluctuated a bit since June. It's gone up and down. Up to 2 in late June, right around 4th of July, and then now it's back down below 1. So as a state, we're seeing that case counts are decreasing, and we're keeping that R0 number below 1, which is exactly where we want it to be. Next slide. And then this one really just shows the demand for intensive care unit projections going forward into the fall and the winter. And it's based off of social distancing. So it's really looking at how well will we continue to social distance, and depending on that, what will our ICU demand look like? And so over on the left-hand side, we're looking at near-term projections, so up through November. You'll notice that if our social distancing as a community, as a state, remains at 75%, you'll see that blue line, it continues to take us downward. So that means that we're going to see case counts continue to decrease, and we're going to continue to see ICU demand decrease. However, when social distancing decreases even by 10%, and then later on only by 5%, you can see what happens to our ICU patient demand. It just skyrockets. So even at 50% distancing, if 50% of people social distance, our ICU demand, it begins to skyrocket. Looking at long-term projections, same idea. You can just see that purple line shooting above that maximum threshold there of about 1,800. So, it really just mimics and echoes the importance of continuing to distance. I think, as we have begun to see case counts decrease, It's easy to begin to kind of loosen up on our restrictions. As long as we remain in the pandemic and as long as we don't have a pharmaceutical intervention, mask wearing and distancing are going to be the most important tools we have. And I just want to continue to emphasize that, as I think everyone else is emphasizing just how important it is for us to maintain those two strategies along with the other, hygienic practices that we're used to. So that's the only slide I wanted to share there. There's a lot more to the modeling that they did, but I think this one kind of painted a pretty, an overall picture of just what we could expect if we don't continue to distance and wear masks.
I just wanted to add to that, Josh, that this assumes that masking remains at 90% too. So that statewide mask order is really a critical function to this modeling as well.
Thanks, Karen. Yep, exactly.
Karen or Josh, with the universities and colleges back in session and so many young adults on campus, when might we begin to see the impact of return to colleges, in terms of the impact on the state, and then second of which is we're coming into Labor Day, and what are the anticipation issues that you see now going forward for those two huge events?
Josh, I'll jump in and then I'll let you answer the details. So the modeling group from the Colorado School of Public Health is actually going to overlay what they think is going to happen with the decline in social distancing based on what's happening with the universities in particular. So they're looking at a high level modeling to see sort of how that will play out in their next modeling exercise. And Josh, I'll let you talk to any of the details of those questions.
Yeah, I think they're really thinking it's going to look somewhat similar to what we saw after 4th of July. There's definitely going to be a bump. I think the question is how big will the bump be? And it'll be that same type of indicator, right? We're going to see, about 2 weeks after Labor Day and after colleges, really start to pick up their pace. I think that's when we're going to begin to see that bump. Then we know that, hospitalizations and deaths can follow from that. But it's really just going to depend on, again, as what Karen mentioned, distancing, mask wearing, and how much we continue to adhere to those things as well. So there's definitely going to be a bump from what the projections and modeling are showing, but I think they're hoping that it can be maintained to a pretty small bump compared to what we're used to seeing.
And I'd just like to add, I agree. Josh, thank you so much for showing those two graphs. And it's so interesting how Colorado, the state epidemiologists really use social distancing as a modeling and modeling based on that, trying to keep the other factors like mask wearing. And it shows overall that, yes, I expect that there will be a bump as well. And hopefully it won't be as big as the 4th of July bump. But it also really goes to show and remind us all that this is in our hands and we have control over this, and the social distancing and mask wearing work, and that if we are diligent now that our numbers are low, if we're diligent through the fall, that we can and we have the ability to keep the numbers low. I think it's really interesting comparing to the models that were done earlier in June from the state that predicting a huge bump in October and November, and potentially that huge surge that was previously predicted might actually not be so big or might not happen. So we'll see how it goes. But again, it's in our hands. It's in the community's hands, it's in visitors' hands, and just trying to be diligent through everything. And hopefully the bump isn't that big from Labor Day.
Thank you very much, Kim and Josh and Karen. Do we have any questions for any one of our presenters so far? I don't. Oh, Bill, go for it.
Thanks. Question for Josh. About 6 weeks ago, there was some talk about certain blood types being less susceptible to COVID. And I noticed on your slide for South America, a drop, although that was in regard to influenza. I'm just wondering if you know, or if you've heard any studies about certain blood types that are less susceptible, and if that's playing out in any of those statistics.
Josh, it looks like you're muted.
Josh or Kim, I see Tom Kurt has his hand up as well.
Sorry about that.
Okay, go for it,
Sorry
Josh.
about that, Marky. Yeah, Bill, I think, there's a lot of studies on that. I'm not going to remember right now which blood types or RH factors were less or more common. I can't remember, but there definitely has been study and research into that. And from what I've read in the research, I think there's some question about, looking into, genetics and different blood types, especially looking at case counts in Africa. They've seen that, case counts there for COVID are just a lot lower than they've seen in other places. And they don't know if that's really due to a lack of testing or if it's, if there's other factors going on there as well. But definitely something that they've been researching a lot on. I haven't kept up too closely with the blood typing. I know the research is out there and it's been studied pretty extensively.
Studies in Spain and as well as Italy have shown that blood type O has a lower rate of COVID.
Positive or negative? O positive or O negative, Tom?
Negative or positive, it doesn't make any difference. It's just blood type O.
Well, then I'm a lucky lady. Okay, I see Brett.
I just wanted to chime in that those studies, I don't think that there's anything definitive about blood type at this point in terms of being able to guide people or make it a higher risk factor for other blood types other than type O, but there may be more studies that come out and make it more definitive. But at this point, from a physician's point of view, we don't consider that and we're not getting people's blood types routinely to look at this. And the studies are not definitive on it.
Brent?
Yeah, just a quick general comment, and that for me is that, I'm so happy that everything is going well. However, that's the present and the future is unknown. And I'm always afraid of that old waking up on third base thinking you hit a home run analogy, and that, we believe the social distancing, mask wearing has all been super effective. There could be other factors at work too, ones that we didn't have anything to do with. And so I'm just saying that this is just a great argument in favor of continuing to do what we are doing, strong messaging, and making sure that if we do anything, we overreact a little bit, because we can get behind the curve in a hurry in this thing, as other states have proven. So that's all. Thanks.
Thank you, Brent. I see Krista's hand go up.
Thank you. Yes, I just had a quick comment too, because I just wanted to make sure that these dots were very connected. That I think mostly from what I've read about the flu transmission rates in the Southern Hemisphere, it has a lot to do, they believe, with people getting flu shots, social distancing, and mask wearing, because the countries down there have been taking this very seriously. And I just think that kind of dovetails with everything that's been said. Again, I just wanted to make sure it was very clear that I think part of the reason we are getting lucky with the flu in the Southern Hemisphere and hope to be getting lucky here too has to do with what we're implementing for COVID. And so continuing on this diligent pathway is really important for all sorts of reasons.
I don't see anyone else's hands go up. Thank you, Josh and Kim. Karen, we're going to move into community priorities and trade-offs for fall and winter, schools, transportation, winter season, indoor spaces. My, oh my. I think our public health staff have been very busy working on all of this. So go for it, Karen. We look forward to your discussion.
Sure. And I'm glad that Josh brought up the topic of equity, because I think you'll find throughout the Board of Health presentations today, there's a thread running through all of these components, and it may be really blatant or it may be more subtle, but we've really gotten back to our roots as a department and our core value of equity, and have really had a little bit more space and time to think about, what does equity mean in the face of COVID-19. And it's been, when you're dealing with disease transmission and a very acute crisis, it's hard to remember all of the equity pieces that we know and believe in, and it's hard to weave that into the work that we do. But it is a core value, and we're, again, I think finally having some space to get back to that, and really looking at health inequities within our community. So just, again, it may be more subtle, but as we go through the presentations, if the board members can really think about this in a frame of health equity, how do we reduce disparities in our community? It's great to see that even with Josh's data around, or the data he shared with the Latinx Hispanic community, that we're seeing less disparity there, but we do know that there is greater impact to folks that have suffered from systemic inequities for a long, long time. And so I wanted to just bring that word up and again, have it sort of flow through our meeting today. But I'm going to switch gears a little bit. So we talked about social distancing, and really we've been thinking about, what are the things that are really community priorities for all of us, and the impacts that those community priorities might have on social distancing, and then what are the things that we might want to consider as trade-offs to allow those community priorities to happen. So Lindsay, next slide, please. So we have heard and believe, to, again, getting back to our kind of roots and what's of value to us around determinants of health, that schools are really, should be on the forefront of everyone's mind as far as the types of choices that we're making as a community and the types of decisions that we make, because ultimately we want disease transmission to be so low in Picken County that schools feel very confident and comfortable in having in-person learning. And so what happens in our community really allows our schools to function in what's the best model for kids, which is, having in-person learning, being able to interact with their peers and their teachers is so critical to their own social emotional well-being, as well as their academic learning. And so as we move forward, into fall, and thinking about that as schools as a high priority for our community, what are the things that we want to trade off, or what are the things we're willing to sacrifice in community to allow for that to happen? The other things that we've been hearing about is, we want to have a successful winter season. We want tourism to be able to sustain the workforce that we, are so critical to both the economy of the community, but to individuals' economy. We want people to be able to have a job and to be able to make a living and be able to put food on their table and get health care and all of those important things that are critical for people's own well-being. So what does a winter season look like for us as a community, and how do we prioritize that? We've recognized transportation has this integral role in a lot of things with employment and with the winter, with the ski tourism season. And so transportation becomes kind of a linchpin for our community in particular. And finally, recognizing that as the weather gets colder, more and more people are going to be coming inside. And so thinking about that just as another kind of factor of, if we want to have, in-person, other in-person kind of activities, what is that going to take? Again, what are the trade-offs we might need to make, because we know that's going to happen. So these are, I am, part of the conversation today is to sort of come up to, do we all agree that these are the community priorities? So that's the first step. And then recognizing that all these community priorities actually reduce social distancing. So knowing that, and knowing social distancing, just even looking at the modeling that Josh showed, that we really want to find that balance. Then if these are the activities that we think are really important for our community, and we know that they're going to reduce social distancing, what are other things that we can do to balance that out in the community that might increase social distancing? So that's really the conversation I'd like to have today with you all. Next slide, Lindsay. So I think the first piece is just getting to, are these the right priorities from the Board of Health's perspective? is school the top priority, you know, in relation to all of those things? And so when we think about, again, in-person learning, transportation capacity, tourism in the winter, and those economic activities that start to come inside as the weather changes, are we missing any community priorities or any of these we want to take off the list? So I'm going to sort of turn it back to Marky and hopefully have you facilitate a little bit of a discussion around that. I think you're muted.
There we go. Thank you very much. In thinking about the 4 community priorities, one being in-person learning, increased transportation, and I just lost the slide presentation. Oops, here it comes. Oh boy, then my computer acts up. I have to bring it back up. Here we go. Tourism in the winter, thinking particularly about the fact that we are a ski resort. And lastly, the economic activity indoors, the restaurant capacity, and for most social gatherings inside. All of those are competing issues, and quite frankly, they all have to be addressed. But I'm going to ask the board, are we agreeing that these are the 4 community priorities, or do we need to add any to the plate for Karen and staff? Any thoughts? Tom?
I'd like to add immunizations. Apparently, we're having an immunization task force meeting on Friday.
Okay. And when you talk immunizations, can you talk about it? Which immunizations are you want to, is it all inclusive, Tom?
Well, first of all, you need to have a way of documenting the immunization, which I've discussed with Karen. There are different systems where you can document that online. Number 2, there are going to be at least 4 immunizations that are going to be available from different manufacturers, and you have to really distinguish them from the standpoint of effectiveness or side effects. And 3, apparently 2 immunizations need to be given to really be effective. So that needs to be taken into account. And in recent news, the CDC has announced November the 1st as a possible date of immunizations. I'd like to remind you, as I'm a former FDA medical officer, that the FDA approves immunizations, and then the CDC can have their ACEP, or the Advisory Committee for Immunization Practices, then recommend the immunizations that the FDA approves. So I think November the 1st might possibly be stretching it a bit, and I'm not going to be first in line on November the 1st. I'm going to wait a little bit and see what happens under those circumstances, if it's approved so rapidly.
Well, Tom, recognizing, I think some politics have been kind of weaving that whole strategy of a November 1. I would totally agree with you. I'll be the last in line. So you can have the place in front of me. We need to let the drive decision-making for the entire country, not politics. So with that said, how about other ideas here that we might want to add onto the plate? So we've added immunizations. I'm also very interested as you go through this in thinking about, I sit on the RAFTA board, and I know ski season is coming. We know we've got buses that transport tons of skiers. Can you talk a little bit about what kind of conversations you're having with RAFTA and the ski company? And then 3, the tourism in the winter. Can you give us a little heads up?
Sure, yeah. So we have been meeting with Aspen Skiing Company, as well as a joint meeting with RAFTA, as well as the John Peacock and Sarah Ott and Clint Kenny, so representing the municipalities. And so far the conversation with RAFTA is that they're looking at different ways that they can increase capacity right now, and doing some really good and careful analysis. And I probably have said this before, but I will say it again. I think RAFTA has been a model in our community for really, really thinking through very complex kind of thinkings around transportation. They've just been, and talk about equity, you know, that is a core of what they're really trying to provide, is people having access to transportation to get to work primarily. And so they have really had the best practices that I think I've seen in transportation. And so they are continuing to be thoughtful and careful, and really weighing in all the best practices that they can. So what they're currently considering is looking at an increased capacity to potentially 50%, which is where Ecotransit is over in Eagle County and many other transit systems. So it's not outside of anything any other transportation organization is looking at. And I think that's their first step, and they're looking at maybe some elevated capacity in shorter routes, like less than 15 minutes, but looking at keeping windows open and all sorts of mitigating structures that they have had in place all summer. So they are putting that plan together. They're going to bring it to public health so that we can have a dialogue and consult with them around it. And that's the next step. But again, I really have a lot of confidence in that organization to think about their employees' best interest, the best interest of transportation in the community, and really thinking through all those ways that they can make public transportation safer. We also, as a team, have done some analysis of different transportation systems across the country to see where different transportation systems have gone for capacity, but also have we been seeing any outbreaks in transportation, just so we can have a gauge of whether, you know, is this where the risk level is around transportation in general.
Marky, can I add to that real quick?
Yeah.
At yesterday's meeting with Senator Bennett, it came to our attention that I think it's the BoH system. Is it Eco Transport, the Eagle County system?
Yeah, it's ecosystem.
Yeah, they're increasing their capacity to 50%. Karen, I thought it was like immediate. I thought they were doing it. So I think that's a good model for us to be watching to see what they find out, how they're doing it, and what if they're seeing an increase in numbers based on use of their transportation system.
Exactly, Patty. Yes, that's correct.
See, Brent?
Yeah, I'm not sure it's the Board of Health's position to make suggestions to SCICO, but, you know, Europe has for years had things like ice bars and these kinds of things. And I know SCICO's got an issue with getting food on the hill and what to do with people. And the European model, these ice bars can be located just about anywhere. They can be serviced, you know, by ski-doos and this, that, and the other. And it lowers the density of people being in any specific place to eat. They would have various places to do it. So it would solve a lot of issues basically at once. And I don't know if they're considering that, but I think there's going to be a huge problem this winter, and SCICO has mentioned it, about how to service people on the hill. Thanks.
Karen, you probably have more information on some of their plans than most of us. Bill Massett might have some updates, but I don't know. So anyone want to speak to what's happening with SCICO and some of their thoughts?
Marky?
Go for it, Patty.
Yeah, we also learned yesterday, because Mike Kaplan was at this meeting, that Key Company, of course, is still looking. They're watching at what BoH's doing as far as their registration system. I don't think Key Company wants to go in that direction. And I heard a report about the concerns over the reservation to get on the mountain system, and going to be pushing people into unsafe conditions in the backcountry. So that's something else we need to keep an eye on. If you can't ski the mountain, they're going to be skiing elsewhere, and that's not always a good idea. Ski companies looking at, you know, capacities for restaurants where you can call, order in, take it out, and locating tents throughout the mountains so people can social distance in other places and in the restaurants. Of interest too, they're also, we're talking to Senator Bennett about exemptions. I guess there's been an exemption in Maine for forestry industry from certain requirements of public health orders. And also, Karen, there was one other state, and it was something else really weird, not related to forestry at all. Karen, can you remember what it was?
Kentucky.
Oh, I think it was around the J1 visas. Is that, sorry, Tori, go ahead.
Yeah, Kentucky.
It was Kentucky, and what was it? Oh, it was horse trainers in Kentucky.
Markey, Greg
Yeah.
here.
Yep. Go for it, Gary.
I was just thinking related to these things. I'm really glad to hear about what the conversations with RAFTA as a RAFTA board member as well. I see that they're doing their absolute best to keep people safe, but I'm always reminded that we've been at 1/3 capacity. We're going to bump it up to 50%, 1/2 capacity, which basically means the cost of running a bus is either gone up 3 times or it's doubled just to serve, to serve the community, because it requires twice as many buses if we're at 50% capacity. So I've been encouraging and hoping that we can support RAFTA and anyone else who has to go to reduce capacity to come up with better ways to protect people and keep an eye on the cost, because what we're seeing is the cost of everything has gone up dramatically. And I'm just wondering, is there any, do we have an opportunity to double up on the mask, advice? Maybe we need to move up to better masks from the masks we have now. We started out with a great mask campaign. We've got 90% uptake. It's great. I think masks have made a huge difference in social distancing with our curves this summer. So as we start moving on to buses and indoors and the opportunities to be closer together are increased, is there anything we can do with the efficacy of masks or methodologies for social distancing while being proximate to people? Just wondering. And along those lines, air conditioning, HVAC systems, we're going to be relying more on pulling outdoor air, meaning cold air from outside into buildings or into buses, which means people are going to either be cold or we're going to be doing a lot of heating. So energy costs are going to be going way up. But it occurs to me that maybe a campaign to encourage people, winter visitors and skiers and people in Aspen coming to be prepared to dress warm and be prepared to be outside. You're not going into the restaurant for lunch, folks. So maybe winter fashions, here we are talking about fashions again, sorry. Maybe we ought to start encouraging people to plan on dressing warm and being outside for their experience in the mountains here, because that might be the way to keep them safe. Just a thought. And if there's any support we can give to RAFTA or anyone else on making their space safer and ultimately reducing the costs to them of operating their system, I think that's going to be useful and beneficial. Thanks.
Thank you, Greg. And to echo Greg, not only do we have the challenge of, as many of you know, is we've got a backup bus following a bus to keep it at 50% capacity. And that is increasing each and every day, the backup buses requirement. The thing is, we just may run out of buses if that continues. So it's an interesting dilemma in terms of thinking about winter season and being here in Snowmass. It's generally standing room only coming up either out of the Brush Creek parking lot or out of Aspen on the buses for skiing. So I'm almost thinking this is not going to be nice. We encourage people to ski the mountain in which community they are staying. So if you're coming into Aspen, you're going to be restricted to Aspen Mountain. If you come into Snowmass, you can only ski Snowmass. I'm just saying that so we can reduce the number of people on buses. And since that was the most unpopular statement, I think we've got to think out of the box.
Marky, I appreciate that. If I can jump in and follow up on that, I think that's actually a good suggestion. Less travel, less opportunities to be on transit certainly makes sense if we can continue to do that. I was going to say, if we can support RAFTA and others in the way of, so they're not just going to wait for the state or for a guideline to come from up above, because as we've noticed, the state guidelines have changed fairly quickly, and we're never sure when they're going to come, if they come. I'm I'm going to encourage people to be innovative. This is, we might have an opportunity to actually innovate in ways to keep people safe and keep people warm and get them where they want to go here. And that could mean, coming up with ways to filter air on the buses or in the buildings, and process it or sanitize it as it gets distributed. I think there's a lot of talk now about how ventilation systems and air handling systems work. And it might be, we need to put some, if we can, maybe just help do the research on it. I don't know how we can support them, but something tells me that's going to be necessary.
Yeah, they're very true. And we have a RAFTA board meeting next week. Community is always invited to participate. Brent?
Yeah, just in terms of innovation, I go back to the European model. One of the things that's hugely popular all over Alpine Europe are Christmas markets. And I mentioned this some time ago, probably can't do it this year, I don't know. But, all I can tell you is that I don't care how bad the weather is, everybody's out there. And they're having their hot rum and Jaeger tea, and they're eating. It's all outside, easy to social distance, and it's temporary. And it doesn't even need to be temporary, because some of the buildings actually look pretty substantial, and yet they break them down. And this would be something, this was proposed some years ago here. I thought this would be a wonderful thing to sort of morph Aspen into something that doesn't necessarily rely 100% on skiing, that it's an environment for families to come, especially for children and such, during the winter. So again, this is a province of Ski-Co, but it's a way to, not risk that much money, I believe, because these companies are pretty self-contained. They can come in and set this kind of thing up, and everybody does well. So, another thought.
Sounds like a great idea. Do I have any other comments, Tom?
If you recall, we raised a $2 per cigarette pack tax, which was supposed to raise $700,000 in the first year in Aspen. I'm not sure what's being done with that money, but it could be a source for funding for some of the things that you're mentioning.
Very, very true. So Tori, there's an idea for you. Okay. And I think we're already thinking similarly here in Snowmass, turning our malls into Christmas markets and et cetera. So maybe very interesting period of time as we go into the winter season. In terms of the restaurant issue, I've been asked by several restaurants over the last week, and I know they're all planning and trying to do what they possibly can. Do we have any guidance coming out of our public health department regarding restaurant capacity as we begin to move back indoors? Or are we going to see a lot of those little heaters all over?
Yeah. Hey, Marky, maybe I'll jump in here. So there's probably a couple of questions on the table. I just want to be sure we bring it back to these 4 community priorities to make sure we're talking about the right things. And I think I've heard a lot of discussion right now on numbers 2, 3, and 4, as far as ideas and kind of interest and energy. Want to make sure that number 1 is on the priority list too. And then, so I want to be sure that we come back to that original question to answer your question, Marky. Some of this is coming together right now because the state has also proposed a matrix for safer at home levels, as well as the protect your neighbor and stay at home. And it's a little bit like what we've done locally with our Corona meter, which is to have a set of metrics and standards. And then based on how the community is performing, then there are mitigation levels tied to it. I will say that what we're anticipating, even in the protect your neighbor, the loosest iteration of the state public health order, which we can't be less restrictive than, there are still restrictions on indoor dining capacities based on social distancing and that sort of thing. And so I think that's where really focusing on those economic activities that typically happen indoors, whether it's opportunities to look at how can you safely that space, like what Brent was saying, you know, maybe it's changing our views of what activities should be outside. Maybe it is how do we allow for some temporary spaces to be developed for that activity to occur in. Each of these 4 priorities has a lot of work that will be done by different entities. We just want to be sure that as public health is involved in doing research and providing advice, that we're on the right priorities, because we can be torn in a lot of different directions. And then Tom, you had recommended a 5th one to this, I believe, which is the vaccination planning. So I tried to both kind of make sure we're redirecting back and hopefully answer your question a little bit, Marky.
Thank you very much, John. Yes, we did add immunization. I'm looking at some chat notes coming in. Krista, she likes all 4 priorities in their current order. Okay, any other comments? Yeah, Tom?
If SCICO could document your immunizations from either the public health office and put that on your ski pass, perhaps that could give you privileges on the mountain so that you wouldn't have to use the porta potty, for instance, and go inside. But I think there would be a way of people documenting their immunization so that they're treated more, as a safer individual skiing, if that is possible.
Somebody's phone is ringing.
But I have to say to Tom, that's only if the immunization is proven to be effective.
Yeah.
That's true. That's true.
Who knows where we're going with all this. But no, I'm looking at some notes coming in. I see that the board is are all agreed that the 4 community priorities and the 5th immunization planning are the priorities. Okay. I don't see any other hands going up. Let me scroll down, check everything here. Bill?
Just a question about recognizing that we can be more restrictive than the state, but not less constrictive. Increasing transportation capacity on the buses. What is the state regulation currently?
Yeah, so it's a little tricky. The state has guidelines out that I think right now indicate that capacity should be actually at 20%, but their guidelines, they're not required. And so there's a little bit of a mixed, I guess, sort of a mixed message that's coming from the state around transportation. Transportation is considered in essence, an essential service. So there's a lot more autonomy at the local level, and for us to really work collaboratively with the transportation services and local public health, because I don't think there's necessarily going to be a directive at the state level around that.
Does that answer your question, Bill? Okay, got it. Anyone else? Okay, Karen, you've got support from your board on these priorities.
Marky and Karen, sorry, Greg here one more time, just to pitch in. I think that because these are changes caused by this disruption, there's a certain amount of stress and anxiety caused from it. If we can really work on messaging the possible good things that could come out of this disruption, this would be a good time to do it. So, not being Pollyannas, but being optimistic and showing that it's possible that we may have a good outcomes from this that could improve the health of our population down the road in other ways. Or, there might be some really good things that come from this. And I just want to make sure to emphasize that, because otherwise it's really easy to look at all these changes and be pretty discouraged. And I don't think that's the message, nor is it my viewpoint.
Well, thank you, Greg. I agree with that. And just listening earlier to John Peacock as he's traversed the country over to New Hampshire, I would love to see our newspapers take on a lead article about how honored we are to be living in Picken County and the work we have done, and celebrate our public health department and the BoCC and this board in terms of really pulling this together and making this what I would consider one of the safest communities there is across the United States. So let's just be proud. Let's get that messaging out and keep our nose to the grindstone as we continue to persevere this awful virus. Okay, now moving on, Karen, I know that you and Josh and Suzuho have been working on the Picken County testing strategy. Do we want to move into that part of the agenda?
There's actually just one flip part of this part. So there's the agreement of the community priorities, and then I do want to talk about the trade-offs. So this is just that's okay. This is the harder part, so maybe that's why. And so Lindsay, can you go ahead and go to the next slide? Thank you. So thank you for, just having that dialogue around the priorities. And it does get to this piece of what Greg is talking to is, there are so many opportunities, I think, as a community. And I think the flu is a really good example of that, right? So to Krista's point, if we can get more people, and Kim's point, more people vaccinated this year, we're going to see lower flu transmission. If we are practicing social distancing and all the things that we do with COVID, we'll hopefully see other diseases decline as well, other infectious diseases. And so it is this opportunity to have other abilities to stay healthy just on the disease transmission component, but it also is a way to reimagine. And I think that was that's our 9th goal, right? That we haven't looked at our goals in a long time, but that is our 9th goal, to reimagine our community. And, what are some things that we've learned through COVID-19 that allow us, that can stick, that are really good ways of being and doing things, and how can we bring that forward in our culture moving forward? And I honestly believe, like, if we could get some of these disease practices right, hand hygiene, like, it's so simple, but if everybody just kept doing that long after COVID, we would see lower rates of all sorts of diseases. So I do think that this is an opportunity, and I don't want to paint a negative, depressing picture of moving forward. We just looked at our corona meter today. We analyze it twice a week, and it is now in the upper blue zone. So it's not in the protect our neighbor stage. I just want to make that very clear, but it's for the first time in the blue. And I think that is a really great thing to acknowledge. And it kind of flips around a little bit. So, in 3 days, it might be back up into yellow, depending what's going on. But it's the first time that, it's the first time since we started the chronometer that it's been in blue. And that is something to acknowledge. With that, we recognize with those community priorities that we just agreed to, that those do decrease social distancing, right? That's fundamentally what they do in relation to disease transmission. So what are the strategies as a community that we want to consider that would be used to increase social distancing? Because again, we have to get that balance, that teeter-totter kind of happening, that if we know we want in-person learning and that's going to decrease social distancing, what are things we can do in the community to increase social distancing? And what are the trade-offs we're willing to make as a community and as a society to allow those things to happen? And I'm just going to give you some examples, and I'm not really asking for us to dive really deeply into this and decide today. I just want to paint the picture of of, as we move forward through the fall, decisions as a board that you might want to be thinking about or we might want to consider. So we know we always have that policy decision. So within the public health order, we have the ability to use that public health order as a mechanism to increase social distancing, right? Is sort of what all of those things do. When you reduce capacity, you're increasing social distancing. So the policies that we know in place, like I show an empty bar. We still have a restriction on opening bars. The state is probably going to have bars closed for a long time from what we can tell. And so is that a continuous policy to think about, you know, as we move forward, is in order to get kiddos back into in-person learning, we're willing to make the sacrifice that bars don't open in our community, knowing that there's really high disease transmission rates when bars open. The other maybe easier thing is places that have the ability to have their workforce still continue to telework or work from home. Right now, you know, there's an ability to have 50% workforce coming in to the office, but maybe it is a decision by a big employer to say, actually, we're going to keep that capacity at 25% because we recognize that the more people we bring into the office, the more likelihood there's going to be opportunities for disease transmission, but there's also then the impact to the transportation system, right? People might be then taking the bus into work. So if an organization has the ability to have people work from home, is that a trade-off that we want to ask our organizations to make in Pitkin County so that, again, kiddos can get back in school and we can have a successful winter season and all of those things that we just talked about. Transportation can really accommodate the essential workers that need to get into work that don't have the choice to work from home or the ability to. So those are just some examples of that. So we have the policy side and then we have the practices side. And these are things like cohorting. So we know that the schools have been designing cohorts. This is something you can do on the mountain as well, right? You can have cohorts, social bubbles that then allow for better disease containment. It allows us to actually do really effective box it in strategies with cohorting. So it has a practical effect to containing outbreaks. And it also just allows for smaller group sizes in essence, and that's also a social distancing practice. So just one example of cohorting can go well beyond schools. It's a practice that can be implemented in many different places. I always use the 6 foot distance. I know that in masking, we all know that that's such a critical thing, but I don't anticipate that even in Protect Our Neighbor, that we would still be asking people to social distance. We would still be asking people to commit to the 5 commitments of containment long after we are in a place of Protect Our Neighbor, because those kind of practices don't cost money. They are individual, so any individual can participate in those. They don't impact our economy. And so the 5 commitments are really simple things we can do long term, and we will need to do these long term. I just know that that's going to be part of our society for a while, but it continues to be something that we can again do to increase social distancing, to allow us to have all the things that are really important to us, those priorities we've just acknowledged. So those are just, again, examples. But Lindsay, can you click on hyperlink on the trade-offs for community priorities title? This was done by some physicians in Texas. It's probably needs to be tailored for our community, but I wanted to just give it to you as an example. And Linda also sent me one from, I think it was from Colombia, that they put together something like this too, but we've just been getting it translated back from Spanish to English. So this is just a way to look at risk in different settings. And so when we think about trade-offs, this allows us to think about, Lindsay, if you can scroll down a little bit toward the bottom, it just gets more and more, these situations get more and more risky, primarily because of the indoor nature of them at the very bottom, the mass gatherings of folks at the very bottom, the fact that they're, indoors, a lot of people together, the kind of activity, if there's a lot of, singing or something like that, or a lot of expiration, that's going to increase disease transmission. So when we think about trade-offs, we can also think about risk. when we consider what trade-offs we need to make. So you can see working in a week in an office building only has a risk level of 6, but it seems like it's a pretty easy trade-off for us to make as a society if people, again, have the ability to work from home. Now we know going to a bar has that probably the highest risk. So that may be a thing that we want to consider for a long term, is that we just really restrict that from happening in our community. So that's just a way, again, to think about trade-offs in the future, is where are the risks and what are the things that we might want to really think about as far as a risk-based decision. So Lindsay, can you go back to the, so next slide here. So ultimately, yeah, Greg, go ahead.
Just wanted to say it would be great to see a chart like that made for our community, our winter community, keeping in mind what Brent said about ice bars, outside bars. You know, we bundle up, and if we're going to a bar, it's going to be outside, you know, sitting on an iceberg. I'm just wondering if we should start looking at opportunities like that. So it's not, let's shut all the bars down. It's more like, let's move all the bars outside, and how will that change our status on this curve? Just a thought.
Absolutely, and thanks. That actually leads into this next thinking. Yeah, thank you. So actually, go, Lindsay, can you go to the next one? I think the next slide. Nope, sorry, go back. Back, yeah, sorry, back one. So that is exactly this piece of policies and then mitigation strategies, Greg. So that, I think you're hitting the nail on the head of what are the things. So exactly like you said, maybe at some point, if the state allows for bars to happen, and we do too, that it is a different environment. SCICO's looking at tenting, right? So that's a different environment to allow restaurants to happen in a different way. And so those are the mitigation strategies. And when we're talking with SCICO, it goes back to someone made the comment about masks. You know, maybe it's asking for SCICO employees to have a higher grade of mask that they wear, because we're, you know, particularly concerned about employees and exposure. And so what are some things that we can tinker with on the mitigation practices side so that we actually don't have to go to the policy side, right? Is exactly what you're saying. Like, how do we find the ways to make these work without saying, yep, everything has to close down? How do we mitigate in this setting that might be the teeter-totter that we work through? And I think that might have, actually, Lindsay, can you go to the last one, and then I'll,
yeah, that's
yeah.
Okay.
Yeah, so that's it for now. I want to prepare, you know, as we go forward through the fall, and if we get to this point where we do see rates start to rise again, and we already have in-person learning in the schools, and that's our goal, then what are the conversations we need to have at that point?
Agree. Okay, any questions for Karen before we move on? Okay, Karen, you want to move into the testing strategy next?
Yes,
and
please.
That is Josh and Suzuho. So,
and I'm going to lead off with the first 2 slides, and then I'm going to turn it over to them. So we had Charlie put together a testing strategy for Picken County, and the team had an opportunity to go through that testing strategy and really just review it and refine it. And so we have a number of priorities that we're looking at. We've talked about this with, and Kim can add to this, we've talked about this with the medical advisory team and the AVH team, and we're still refining it. So I just want to be very clear that this is still in a draft form. But we wanted to bring the goals to the Board of Health so that you're aware of where we're heading with our testing strategy in Picken County. We also want to bring this to our regional team with Eagle and Garfield, and talk through this and see if we can have this fold into the regional testing strategy. So that's our goal as well, is to regionalize this. So we have the first part of this is to actually hire someone that can coordinate testing throughout Picken County. This isn't doing testing. It's not the actual testing logistics. It's not the actual doing of the testing. it is really coordination of testing throughout the community. So working with healthcare providers and thinking through where testing can expand, and going back to that equity piece of how do we ensure greater equity to testing in our community. That's really the ultimate goal of our testing strategy. So we have some funding from the CARES Act. So that's going to help us to sustain this position. We hope to have it hired by October, early November, pending how the hiring process goes. This is a hire, we're not sure how long it'll take to fill it. And next slide. And so I think am I turning it over to you, Josh, or is this mine still?
This is mine, Suzuho.
Oh, Suzuho, thank you. Go ahead. Yep.
Thanks, Karen. So I'll present the next two priorities that were in Charlie's document that our public health team sort of consolidated here. So the second priority is to ensure all individuals in Pitkin County have equitable access to diagnostic testing. So again, this aligns with what Karen said in regards to equity being kind of a through thread for all of these pieces that we're presenting today. So really wanting to make sure that everyone in Pitkin County, regardless of race, insurance status, economic status, everyone has equitable access to testing and to healthcare services related to testing. So we would also expand the availability of point of care health clinics and PCP offices, and then, sorry, that should say point of care testing in health clinics and PCP offices, expand overall testing capacity to align with what the state is aiming towards in regards to overall testing availability based on our state population. And then to also acquire and staff a mobile point of care testing vaccination unit. So we're really excited that we've been able to secure some funding to be able to support the purchase and renovation of such a unit. And then I'm not clicking here, sorry, next slide. The third priority is to ensure broad, bilingual, bicultural communication of testing sites, criteria, guidelines, et cetera. So again, really making sure that everyone in our community, regardless of their primary language, is able to access all of the health information that we have around testing and COVID prevention and guidelines. So we do have some Pitkin County testing locations already embedded into an Eagle County or a regional map that Eagle County has put together, and we want to just make sure that that testing map is up to date, as well as the list of testing sites that are on our website, and that those two resources are in alignment. And then to also make sure that we have some regional communications that really align the testing policies and communications between Garfield, Eagle, and Pitkin. So these are strategies that we've been working on already, but want to continue to move those forward. I'll turn it over to Josh.
Yeah, so our fourth priority is to provide testing for those who live in congregate settings, such as Wickham Terrace, the jail, and those experiencing homelessness. So this testing can really help us to quickly contain larger outbreaks and reduce widespread transmission. We also need to consider the movement inside and outside of the facility that for those who may come in contact with those in the congregate setting. So a goal that Charlie had noted was to establish and ensure capacity for biweekly and monthly testing of 50 tests per week as a goal and something to shoot for. And then also with schools opening, we want to ensure continued capacity to test exposed students, staff, and teachers at our schools and childcare regardless of their symptoms. Next one, Lindsay, or last one. So then our last one here, there are many new tests being made available, so we want to continue to discuss how these tests can be incorporated into our testing strategy. Even though some of the newer antigen tests specifically have lower sensitivity and or specificity, depending on which test you look at, we want to be able to determine and evaluate how those can be incorporated into our already existing testing strategy and also going forward. So for example, the Buy Next Now COVID-19 antigen card test, which is a type of scan that looks for specific structural proteins of the coronavirus. So that test is coming out, and it's reported to be a $5 test. So once that test is available, how do we begin to potentially think about best ways in which that test can be used and which populations it should be ideally used for. So really, as these new tools come out, we want to continue to evaluate and ensure that these tests are being used appropriately. for the right populations and continue to reduce transmission in our community. I think I'll pass it back to Karen.
Great, thank you. So again, these are just the goals. There are many action steps that we will be using to fulfill these goals. So we really just wanted the board to be aware that this is the direction we're moving, and these are what we've set out as our goals, and that we can bring to you further action steps, or let you know how these different processes are going as we move forward. But wanted, again, an awareness, and if you have anything that you feel like we need to add or take off this list at this point.
Karen, just a question in the back of my mind. Where does AVH fit then with their testing within this testing strategy?
Yeah, so again, public health isn't really, we're not conducting testing. So all of the testing that's happening in the community is being done by healthcare providers, and AVH has really been a leader in that testing for our community. And we work, we meet with them and every week. So we have a group of folks with Dr. Levin and myself and other doctors and Dave Ressler and the EPI team. So there's a lot of meetings that happen between the MAT as well as a larger group with AVH. And then there's also a healthcare provider meeting that Kim brings together on, I think every other Thursday night now, and that's a reach out to even more healthcare providers within the Valley. We also have the regional testing coordinator, or testing strategy meeting with all of the hospitals and all the public health departments. So there, I guess what I'm trying to say is there's a lot of communication happening with us and the providers that are providing the testing in the community. So with that, they have, AVH even has a testing advisory team that does the research around looking at the methodologies and the new types of testing that are coming available. And they're doing an amazing job of helping us to better understand how that's happening. So I would say there's a lot of collaboration on this right now, and that healthcare providers will really be integral in making this testing strategy work. Does that answer your question, Margie? Or?
Yeah, thank you, Karen. Any other questions? Tom, I saw that you posted something to chat. Can you speak to the issue?
Yes. Are we in touch with the school nurses, and how?
Yes, we are. So we also meet with the schools once a week. Josh may even meet with them more often than I do, but I'm on a call with them once a week, and that includes school administration as well as the nurses. And Josh, I don't know, I think you're meeting with them more regularly than I am even.
Yeah, and we have a point person, one of our contact tracers, who is in contact with Elise and the team pretty much daily. So we have constant flow back and forth between the school district and the public health department.
Okay, that's great news. Great, Postman.
Just quickly, Karen, it sounds as if what we're seeing is testing that is starting to look more like screening. If it's ubiquitous and it's quick and it's affordable, it seems like the lines between a screen and a test are blurred. And what I'm wondering is if we should be trying to get people comfortable with the thought of being screened in multiple circumstances and locations, so it just becomes a common practice. So we don't have the hesitance or the fear, but it's something that people do. It's like watching how mask adoption came online. It takes a while. Is there anything we should be doing to prepare? It sounds like this new screening thing, if it happens, I want to hear more. Could really be great, but then it's a matter of getting the community to adopt it and go along with it. Would we need to be tested before we enter a building, for instance, or get on a plane or go to a restaurant? Or I'm just wondering, are we thinking about the ubiquity of testing, and do we need to be prepared for it? I might be off mark here, but the thought occurred to me.
Yeah, so I do want to clarify the testing that the strategies that we're proposing here right now are primarily diagnostic testing. So, and Josh, I'm going to let you jump in a little bit, but we're not putting necessarily screening testing in this testing priority right now. And so when we think about asymptomatic testing, we think about asymptomatic testing in relation to the box-it-in strategy. So as someone has tested positive for COVID-19, their direct contacts may be asymptomatic. Well, we're going to be encouraging them to go get tested, but we're not at this point doing screening. I would say very little of this is upfront screening right now. But Josh, I'm going to let you step in on this a little bit.
Yeah, Greg, as you probably saw, the CDC had discouraged or at least took out the piece of testing asymptomatic persons that were exposed to COVID. I think something, we've been talking about here is, I think we don't want to discourage that. We want to continue to do that because that's going to help us to reduce transmission. So really looking at capacity, what kind of capacity would we need in order to continue to do that type of testing? And also recognizing that, lab turnaround time can fluctuate here and there. So looking at these more quick types of tests, even if they're less sensitive or specific, may be able to give us the results we need and help us to continue to mitigate outbreaks and transmission.
Marky, can I add something?
Yeah, Patty, go ahead.
Yeah, and going back to the ski companies looking at a waiver with the J1 visa issue, most of their employees will be coming from Peru and Argentina. And so maybe we want to build in some kind of testing strategy to the ski company bringing in employees from out of the country as part of also part of an education and bringing those new employees up to speed is what we're doing locally for public health mandates.
Has SKICO received that waiver, or they're working on trying to?
Yeah, they just brought it. We just learned about it yesterday at the meeting with Senator Bennett.
Okay, does that mean that they have the waiver?
No, it means they're asking Senator Bennett to look into it to find out what the grounds were for those other two states to get a waiver, focusing it on ski industries across the West, possibly.
Okay, thank you very much. Yes, most definitely. If it does happen, we need to have a strategy of bringing the new ski instructors and worker bees on the mountain from our foreign countries, or what I call foreign partners, to it's kind of how do they acclimate into this newer environment of the Picken County COVID strategy? So
right.
That'd be a Karen and her team. Thank you. I'm looking a little bit at my timeline here, and we need to move on to the Latinx Hispanic engagement, if that's, and Susuho, I see your name there, so I'll let you move forward with this part of the meeting.
Great, thanks, Marky. So I wanted to talk through some of the work that we've been doing since June. Our 3 regions, or 3 counties in this region, Garfield, Pitkin, and Eagle County, have been meeting every other week with the Hispanic and Latinx outreach and engagement group. So excited to share some updates of some of the things that we've been working on here. And before I jump into some of the activities, I think it's Raleigh who's controlling the slides. Raleigh, if you can go to the next slide. I just want to acknowledge all of the partners who have been a part of these meetings. It's really a collaborative effort, and we believe that with equity work, those collaborations are critical to advancing this work, recognizing that there's a lot of community leaders who have been investing in advancing health equity here in the Valley well before the pandemic, and really wanting to contribute to building those infrastructures rather than creating new systems, and really, again, continuing to work with members of the community. So these are the different organizations as well as individuals who have been a part of those meetings. I have my contact information at the end if there's anyone who's listening, who wants to join this effort. It's open to anyone, but our 3 counties have been involved with our public health departments as well as our human services departments and our communications team as well. So huge just thank you to everyone from all of these organizations who have been involved in this work. So the next slide I wanted to talk through kind of the purpose. So early on, again, back in June, the group had been meeting and talked about what's the purpose of this organization or this committee or team. And it's really to increase awareness and understanding among public health agencies as well as county leaders on how local Hispanic Latinx communities are experiencing the impacts of COVID-19 and the pandemic, as well as the way we're responding to it. We recognize that there are often systemic inequities that exist in the way our response has been built. And so we want to acknowledge that and recognize that and find ways to address some of those to make sure that we are advancing equity as much as possible, and recognizing how our response efforts, as well-intentioned as they may be, could be perpetuating inequities. And once we recognize that, we can correct that. Another aspect of our purpose is to, again, build upon existing community infrastructures or to create new ones if they don't exist, but again, really trying to build off of the strengths that we know already exist within our communities to help elevate the voices of those most impacted, to develop opportunities for truly community-driven and ideally at some point community-led strategies with our COVID-19 response and recovery efforts, to respond to economic, mental health, and other impacts of COVID-19, and to also support inclusive data collection and reporting to ensure an accurate understanding of the impacts on marginalized communities and increase necessary resources equitably. So again, this is another big component that ties into the equity work that Karen talked about, really working with the community organizations that we listed previously, tapping into what they're hearing in the community as people who are working day to day, either in clinics or in food pantries, really connected to the community on the ground, doing the work, and hearing what gaps public health and the county may be able to help fill. And then in regards to our approach that's listed on the next slide, these are kind of a few ways that we want to approach the work that we're doing. So we believe that the people most affected by those injustices are the ones who are most effective at changing it. And this does not mean that those who are most impacted are responsible for changing it necessarily, but we want to make sure that voices of people who are impacted by this work, the communities who are marginalized through our existing systems, have the opportunity to share their voice and contribute to these efforts. We also believe that it's important to take a comprehensive approach that positions us in a way that allows us to work in solidarity with other movements. These next two kind of go hand in hand in that we also want to complement and strengthen partners who have that common belief around collective action. So again, not wanting to come in and kind of helicopter in and make changes, but really support the systems that have already been in existence and the strengths that are there in our community as we advance equity together with our partners. And then the last one is around developing strong collaborations that build upon each entity's strengths to best serve the community and advance equity. So we really believe that every individual, every organization has a role in advancing equity. Every decision that we make either perpetuates inequities or creates an opportunity for advancing equity, and that everyone has the ability to help support us in achieving this goal of advancing equity for our community. So we want to make sure that anyone wanting to be involved has a place in that, and that we can build on each other's strengths to come together to make this happen. And then the next two slides, I want to talk through the Protect Our Neighbor grant. So this is from the Colorado Department of Public Health and Environment. They've created two funding sources to allow local public health agencies to really work on things that would help allow us to move towards the Protect Our Neighbor phase of this work. The first part is a planning grant. So it's a $50,000 grant that can be used to fund community engagement opportunities, really sort of community partnerships, listening campaigns, ways to allow us to hear from the community about what they're experiencing and any gaps that may exist in our work. And then the second part of the grant structure is focused on infrastructure, and it's $150,000 that allows us to look at strategies for strengthening, oh no, it's still the same slide, sorry. Just kind of giving a little bit of background around how to develop the public health and healthcare infrastructure. So with those two grant opportunities available from the state, it is through the CARES Act funding. So through December 31st of this year, we identified some different activities that we wanted to work on. So we've applied for the planning portion and received that. We've applied for the infrastructure and waiting to hear back on those, but hopeful that we will get that granted as well. So the group that I just mentioned has been prioritizing areas to work on over the coming months through those grant opportunities. And these are the primary 6 areas that we've identified. So the first is around community convenings, really tapping into that planning grant to be able to hear from the community. There was a survey that was conducted by Voces Unidas that highlighted a lot of gaps in our region's COVID response efforts. And so we want to build off of that already, but also dive a little bit deeper to continue hearing from community members about what they're experiencing and what we can do to help them through these difficult times. So we're kind of doing those concurrently, the planning side as well as the infrastructure side. The infrastructure side, a lot of it will focus on improving our communication. So our communications teams have been doing an amazing job really building out bilingual information. You know, pre-COVID, we didn't have any social media sites. So the fact that we even have a Twitter, Facebook, Instagram, all of that is, I think, great for us in improving our communication. And many of those elements have been translated into Spanish, but not all of them. So that's something we really want to focus in on, that every communication is translated into Spanish as well, and also conveyed in a culturally appropriate manner, whether that's the visuals or the layout of a document or the mode of communication. Hearing from community members that word of mouth may be a better mode of that communication than websites or social media sites. Along those lines, an element of this will be creating a peer education program that we hope to use a little bit as a pilot. And if we're able to secure additional funding or collaborate with Garfield, they already have an existing Promotores program, so we might be able to partner with them on that. But this will allow individuals who are bilingual, bicultural, and truly from the community to be able to be a liaison to the community to help amplify the messages that we have around health education. Testing and vaccinations, I won't really go into that since we just talked through that, but that goes back to the first priority that Karen mentioned in our testing strategy. And then this also aligns a little bit with part of the testing strategy, but it's around securing and staffing a culturally inclusive mobile community resource center. So similar to the Mirabus that Eagle County has, really being able to have a mobile unit that is something that community members will see and be attracted to and feel comforted by, feel safe going into to receive educational materials. It may be a vehicle we can use to distribute vaccinations. Obviously, testing will be a priority early on, but we hope that this is a resource that we're able to use in a variety of ways, and potentially not only with the Hispanic Latinx community, but it could be used for increasing access to testing or vaccinations for people who don't have a vehicle and can't get to a clinic or a testing site. It could be used to address inequities that we know exist with our older adult populations as well. So it could be utilized in a lot of different ways. And then the last part that I'll go into is around bilingual, bicultural contractors and consultants. So we recognize that this work it's critical for this work to be led by people from the community, and that it's carried out with buy-in for Hispanic Latinx individuals. And so if we can go to the next slide, I just wanted to talk through a few of the different positions that we're hoping to fill. These will be, again, contract consultant type of positions, but we're hoping to have 3 to 4 coordinators who can be facilitators and help organize those community convenings to hear from the community about what they're experiencing. These individuals can also serve as those peer educators and resource referrals if people need assistance filling out paperwork to get economic assistance or food security or anything like that. Really having people from the community who can help them out with those elements. We're also hoping to have 1 to 2 folks who can fill an advisor role, really managing all of the grant activities, strengthening and building relationships with community leaders and community organizations, expanding the bilingual, bicultural communications, and again, being that liaison to our communications team to be able to do some communication audits to see, you know, have all of our materials been translated into Spanish? Are they culturally appropriate? What are some new ways that we can be creative and better reaching our Hispanic and Latinx community members? And then they would also help advise the testing and vaccination strategies, bringing that equity lens to that work, as well as the development of the Mobile Community Resource Center, and then the testing coordinator, which we talked about earlier as well. So those are the main things that we are working on. We're hoping to be able to bring on these additional team members over the coming weeks. It's a pretty quick turnaround with this Protect Our Neighbor grant because it's funded through the CARES Act, which only goes through the end of this year as it stands right now. But if anyone is interested in joining or knows anyone who might be interested in filling any of these positions, please feel free to email me and I'd be happy to connect them with further information.
I just want to clarify, so the testing coordinator would be a position we'd be looking at as a temporary position within Picken County, but these others are contract. We're not hiring people, so it would be with a different agency.
Thank you, Suzuho and Karen. Suzuho, just for information for the board, I think it's very important that perhaps we shine a light on the number of positive cases, percentage-wise, that we're seeing in our Latinx Hispanic communities. Do you know what those rates are in Eagle and Garfield and in Pitkin County? Because to me, this is one of the most important elements of the work that is being done regionally.
Yeah, I think the last I checked, ours was around 19, but let me just pull it up again to see if that is still accurate. I don't know. Eagle and Garfield's off the top of my head. I believe Garfield's was around 50% at one point. Yeah, it does look like ours between 19% Hispanic, 81% non-Hispanic currently out of our 198 cases. But I can definitely look into Garfield and Eagles and get that to you all.
Josh, did you have any information there as well? Because I've been trying to follow those stats. Really worried, most importantly, about our workforce, not only here, but throughout the Tri-County area. Josh or
Karen? Yeah, Eagle County.
Yeah.
Sorry, Marky.
Go ahead.
Eagle County had reported to us a few days ago that their I don't have an exact percentage, but it was really high, and it has remained high for a while. So while we were seeing for a while just lower rates of transmission in that community, I know that Eagle and Garfield were still reporting very high rates of cases among the Hispanic Latinx community.
Thank you very, very much. So the work that is being done, I think, does need to be applauded. So thank you, Suzuho, for being our coordinator with our other counties. So thank you very much. Is there any other questions or comments from board members? I don't see any hands going up. And no one has entered chat. So Karen, do we want to move into the visitor strategies?
I was just going to say, Marky, I know we've taken up a little bit more time than usual. So I was going to offer that, or if you feel like it's a priority for the board to do the round robin before the board meeting ends, I think we can do one or the other. The visitor strategy, we could certainly come back to in the next meeting. So I'll let you all decide.
Let's see what the pleasure of the board is. Those interested in talking about visitor strategies, raise your hand. Then I'll ask the same thing. Who's Greg and Tom are visitor strategies versus round robin. Jeannie, you're there too. Patty's there. Well, Krista's there. Bill Madsen's there. So, oops, Tori's thumb is up. So let's go into visitor strategy. Karen?
Okay. All right, Lindsay, or Raleigh, can you bring up the slides?
Hey, Karen, give us 1 second. We don't have the slides available.
They're hyperlinked on the agenda. They were part of the pre-reading.
Okay, give me 1 second.
Sure. Yeah, sorry, I forgot I didn't stick
Very
that in.
well done. It was a good presentation there, Karen. So thank you for putting that together. So once those come up, then we'll move right into the visitor strategies.
While Raleigh's doing that real quick, I just wanted to share, I put it in the chat, but also wanted to verbalize that Eagle is around 30, I think at 39% Hispanic Latinx, and then Garfield is around 69% of their cases. And I also wanted to just acknowledge that both counties have higher percentages of Hispanic Latinx community members. So they're not, we can run the rates if we wanted to compare that, but we have a much lower percentage of our Picken County residents who identify as Hispanic Latinx.
Thank you for posting that. Let's keep that first and foremost in our minds. And let's
And I
move
think
to the
the
visit.
key to take away is that for all 3 counties, the percentage, the rate with our cases is higher than our population. So they're being disproportionately impacted. And it's important for us to think about how to increase testing opportunities, recognizing that no particular race is at higher risk for COVID as a virus. And so it's really a systemic issue that is leading to these disproportionate rates of COVID.
Okay, thank you. And thanks, Raleigh, for bringing this up. So these are the same slides that we shared with you at the last Board of Health meeting that Larissa went through. And there was a conversation, and then I think said, you know, if you want to chew on this and come back to it for this meeting to really talk about what are the strategies that we would want to elevate to the state level. And I'll just tell you my thinking on it, on all of this, is that if there's a low resource strategy that would be easy to implement at the local level and isn't necessarily a policy decision, so like the information forms that lodging could ask visitors to fill out, you know, some sort of commitment to the a commitment to the five commitments to containment. If we asked every visitor to just, you know, sign on the dotted line that you've committed to this as you come into Picken County. So those to me are the low resource things that we could implement on a practice level. And then there's the policy level pieces that I truly believe are best implemented at the state level and are probably a higher resource kind of initiative. So something that might be happening at the airport around screening or something like that. So when we look at these strategies, you know, to think about, for me, what are low resource practices that we could put in place in Picken County, what are high resource, maybe policy level decisions that we really want to push to the state level because they're going to be so much more effective at that level. So with that, Markia, I'm going to maybe turn it over to you if you want to do it. Should I do a quick review of the strategies or however you want to manage kind of the facilitation?
Well, I can't assume that everyone read that part of the packet. So let's do a quick review of the strategies, Karen.
Okay,
and then we'll see if there's some questions.
And I'll do them very quickly. So just a reminder, strategy 1 was really that screening at the airport. So again, I would put this at a high resource level, best done if it was done at the state, that it was just like other states are doing, Alaska, Maine, other states are doing this kind of screening. Well, actually, I should take that back. I'm not sure if they're doing this kind of screening, they're doing testing. But there are, you know, examples of this, I think, at a state level, not necessarily a local level. Number 2, health declarations. So this is that sort of arrival form, could be done in a stage at the airport, but it could easily be done at a lodging facility to just have the health declaration done, where someone would fill out an online form. And there are some states that are doing that. Again, this is tends to work better at the state level, but it's something we could maybe, it's a lower resource practical thing, not necessarily policy level implementation. Next is testing. So this is what they're doing in Maine and in Alaska. So this testing that happens when you arrive at the airport, really do believe that this is high resource. and best done at the state level, that it was be a statewide initiative and that the state would put resources into this strategy for. So this is the quarantine. This is what we've done in the past. So right now, just as a reminder, in our public health order and in discussion with the medical advisory team and Dr. Levin, we have that, please isolate before you come is our current message. This is once you get here, we're asking you to quarantine. So it's a little flip on that. There are lots of states that are doing this. They're doing it in conjunction generally with testing. And John can talk about even his own experiences in traveling to a state that is requiring this. But this is, I think, truly something that we should leverage at the state level. It's very effective. Well, I don't know if it's very effective. It's much more effective at the state level than it would be locally. But just, again, low resource though, but not enforceable. The pre-registration, this is again maybe a more lower resource, local sourced kind of thing that we could do, which we would just need to have the conversations with entities that could do this pre-registration. But it seems like this is much more, it'd be much easier to do because it is a lower resource strategy locally. And then finally, this I think is a no-brainer. We should always be doing this. So how can we work with entities to help with the chambers and with SkiCo and other entities and just do a lot of good visitor education? And we're really committed to this. It probably is a middle of the road resource thing, but it certainly is not going to hurt us to do any of this and believe that this is a good strategy to do locally and statewide. And then, yep, so there's the summary there. So that, there they are.
Okay, any questions, any thoughts for Karen on this, Brent?
Yeah, I just want to make sure I'm not muted. I guess I'm not. Yeah, I tend to agree with Karen. Although I'm in favor of more strict restrictions just about always. However, I think that the analysis, her analysis or whoever, I think is really more correct. Much of this is more apropos to the state. And number one. Number two, I think the low resource, which is I think just a side benefit of the pre-registration, helps us with tracking and maybe most important, or at least equally important, is that it shows our seriousness. And I think the more formal and serious we take this for visitors coming in, they go, okay, people are paying attention to this and perhaps even to me, even though enforcement, a lot of this stuff would always be super difficult. So I think that's, I agree with Karen.
Yeah, I do too. When I was reading this yesterday, Karen, one of the thoughts that I had on that education, do we happen to know if SkiCo will be investing in their placards on the chairlifts and putting COVID information and 5 commitments on the chairlifts?
I don't know.
Yeah, Marky, we have started discussions though, so that certainly we've got a forum where we can ask those questions.
That would be fabulous, John, because I think that 14-minute or 9-minute write-up, you got to have something to do other than just talk to my husband on a chairlift. I got to have something to read. Yeah, Patty, I see your hand going up.
You know, I think what we should do like tomorrow is get a form out to the hotels. At least that's a great place to start. When people come and check in, have them do some kind of health declaration form with the educational information and, you know, some verification that they haven't had symptoms, that they're not experiencing, you know, whatever that standard form is. That's something we could do, you know, tomorrow. And then we could have them, I don't know how we would then get them back to the public health department through some kind of, they could scan them in and send them and we could deal with it at that level. But I think that sounds to me like a good place to start and something we could do quickly. But Karen would be the best to know about resources, what that would take.
Well, that would be a resource issue, but the other coordinating entities could be our respective town governments. So like our marketing and tourism department, we get all kinds of numbers and what their taxes are they're collecting and number of visitors. this would be one more thing that they would have to collect and come
We
in
could
through
do that,
our
bring them
tourism.
in, yeah. But I think with the hotels and the lodging facilities, that's a great place to start. As far as doing at the airport, we have to think about the fact that people are coming through, they'd be backed up, social distancing, et cetera. There is a lot of educational information when you come through the gate at the airport. There's nothing when you leave the airport in Denver when you're coming here, but there definitely is stuff when you get here.
That's for sure. There's a lot of information here. I see some items, issues going into the chat box, so let me pull it up. Linda, I am having difficulty with my video and audio, but she's listening, okay. Kim Levins, would a letter from our BoH to the state in strong support of a state-directed quarantine for visitors from high-risk states areas be of value? Haven't we already done a letter? Nope.
We did, no, we talked about it, but we actually didn't send it in, so.
I think we just may want to do that.
Yes.
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 Tom is saying yes. And I'm looking up and down my little thing to see what Tori's a yes. Yeah, whoops. Okay. How about the rest of you? Just thumbs up? Yep.
Not sure.
Yeah, okay. I think that's something we really should do, recognizing guests come here from all over the world, let alone other states. So
can I just interject something on this topic? I know we've already taken a vote, but couple of things to consider. I know my experience, Massachusetts is one of those states. So that's a first state that we traveled to. And they consider all states not in New England to be high risk, by the way. So they had an option of either doing the 14-day quarantine or having the test within 72 hours. And the reason that I'm bringing of arriving within the state, and the reason that I'm bringing it up is a quarantine requirement is going to be a disincentive. No one's going to come skiing for 2 weeks if you have to quarantine for 2 weeks. So I just want you to think about those broader kind of consequences, and if there's some mitigation strategies, you know, kind of going back to the 4 priorities that you all had talked about. You know, if we want a winter season, it's going to be domestic probably more than international at this point. And how do you have some other strategies there? So if it's too late for me to interject that, it's too late, but I just wanted to throw that out there for conversation.
John, a question for you. So when you got to Massachusetts, obviously you didn't quarantine because you had to get your daughter all the way up to New Hampshire. So did you go get tested, or did you get tested and carry that with you prior to going?
Yeah, we got tested. We filled out a visitor form, and my informal survey of folks is we were in the vast minority of folks who are coming through from out of state. I think to Karen's point, at those volumes, it's very, very difficult to enforce. And so I think what the state's relying on is voluntary compliance, which we all did. We filled out our forms, we had our tests, we were legal, but there's never been any contacts made in relation to that. And we did stick out like a sore thumb with our Colorado plates in quite a few places.
Patty?
Yeah. The other problem too is the 72-hour turnaround for testing. We need to keep that in mind until we get more rapid tests or more labs to process testing. It's difficult for people to get a 72-hour. John, I don't know how you were able to do that, because I have to go back to Denver and I need to be tested, and they're giving me a little more leeway, but that's difficult for some people. Either that or you drove really fast, John.
We did.
I know.
And we ended up doing it, frankly, at a Walgreens in Colorado Springs. They had a contract with LabCorp, and we started driving, and we were just hoping our test results came back well, and we weren't stuck somewhere in the middle of the country.
Interesting. Any other comments?
Well, so we all just were supportive of a letter. The way it's written here is a state-directed quarantine from visitors. But is there? I mean, maybe we don't need to leap to the quarantine. Is there is there another level of support that this board can give to the state for some of the other measures that we were just talking about here?
Karen, is there, I think there's a happy medium here.
Yeah, I agree.
Yeah, the 72 hours or a health declaration or something.
So I guess if the board could just give direction as to whether we've got discretion to include some of those other alternatives that protect that maybe other states are doing, then we can put that together in the letter. Is that kind of where you're going, Tori?
Yeah, that sounds like a good plan, because you all there in BOCC and Karen knows what's happening across all the other states. So best practices from other states.
You know, and I think that this is the letter of support, I think, is going to be more than anything a good conversation starter. You know, I think really we'd want to hear from the state and what state leadership thinks about addressing visitors from high-risk states. So I'd be interested in just starting that conversation. I am just a bit concerned about a letter that goes straight to a 14-day quarantine from visitors from the high-risk states. But I think this is a great conversation to be had with the state.
Okay, I see some other hands going up. Tom, I think I saw yours first, and then I see Patty's, and I think I saw Brent's go up.
I agree with Tori.
Okay. Patty?
Yeah, I agree, John. If you could draft something, and then just if you want to run it by the Board of Health, and would we address it to the governor and CDPHE to Jill Ryan, or is that the direction we'd go? I think both of them need to be noticed of this letter.
Yeah, so the governor has staff designated that's working with CDPHE, and Karen, I'm thinking Casey Wolf in this case, as well as CDPHE. And I guess the only question I would have is, I think we probably either have a week or 2 week lag, and I think what I'm concerned about is the planning for winter season for the state is happening now. So I'm wondering if we could run it by like the chair and vice chair, or do we want to wait for does that make sense? So we can move a little quicker if possible.
How about we just send it out to the 7 members of the board, and there you go.
It's an electronic meeting then.
Yep.
Yeah, I would just do the chair and vice chair and just do a quick turnaround unless you guys have concerns, and then we need to broaden it.
Yep. Okay.
Yeah, and I would just agree also with Tori, but also what John kind of said initially about this testing. I think, you know, it's like a cruise ship, and just before you get on board, they say, by the way, if you test positive, you're not going anywhere. You'll stay in your room for the next 2 weeks. You're probably going to turn around. And I think this is a huge disincentive. And it's also a little unrealistic, because much of that was done at a time when we didn't have the ability to test. And, you know, hopefully, I think if we could get testing down to close to 3 days, that's a fair gamble for a lot of people. And so I think some sort of compromise is important. Otherwise, it's not only unfair in some ways, but it's hugely counter-economic, or whatever the term would be, for Aspen in the winter.
Right. Okay, well, we look forward to seeing the draft of the letter, and I'll get that turned around. Any other thoughts? If not, I'm going to move into a round robin. We have 20 minutes left on the agenda. Do some board members have some issues that they'd like to discuss, and Patty's hand went up immediately. So go for it, Patty.
Really quick, I've had calls from concerned citizens about enforcement again, about the inconsistencies with events that are coming through with special event permits, but then the events are going like to 90 people rather than below 50. And nobody's actually monitoring these events. We don't have staff that can go to all these events unless we have people that like to attend a lot of parties with a lot of people that shouldn't be together. So I don't know how we can monitor the compliance with special event permits, or with issues like with Bootsy Bellows, there's people who are not going to be happy that stricter enforcement issues aren't being applied to that bar owner. So I just wanted to bring that up, that that's something I've been hearing about, and I don't have any great solutions on hand.
Patty, do you know if they're submitting those complaints through the complaint system as well, or is it just kind of coming direct to you?
Because I don't have access to what's formally getting complained about.
Okay.
So I don't know. That we'd have to
Okay.
check with maybe the consumer protection people.
Okay. Cross check that too. Okay.
Thank you.
Brent?
Do you, yeah, I was just gonna say, do you think, I mean, this, I don't know what this sounds like, but I felt it incumbent upon me a few times where I see people without masks, and I say something, I say, wear a mask, and if I have to, then I say it's the law or whatever, but, I don't get in their face. But I wonder, as board members, is this something that, that we all should do if possible? I mean, it kind of makes you like a hall monitor back in grade school, but nonetheless, and to even have some masks. Because, just to be able to hand a mask out like some of the police do, and be able to say, please, for your own sake, for everybody's sake, and put it that way. Any amount of that can't help but help. So anyway, that's my little thought.
Thank you, Brent. Just a
Just real
comment.
quick.
We don't seem to have a problem over here in Snowmass. I would say, and Billy, I'll look at you. I would say we have about a 99% compliance in all of our 3 nodes. So it must be Aspen centric.
Well, I'd say it's gotten better in the last 2 weeks, as far as I'm concerned. Better. And it's usually when I've seen it, people have always been apologetic. They always say, oh, sorry, whatever. They were lazy, whatever. And it's just try to get it up in the public consciousness. But I haven't had anybody say, oh, go to hell. So.
Yeah, well, that did happen to me, but anyway. Patty?
Yeah, real quick. I was at a local restaurant the other night, and there was a birthday party going on, and they weren't following any of the rules. And I happened to have the speed dial, the owner of the restaurant, and called him, and he was great responding. I said, you need to get somebody. And they jumped on it. The bar manager went right over, told him, and he said, I'm giving you one warning. You guys don't sit down. You don't wear your mask. I'm cutting this party off and you're going home. They had the side reserved room, but they were really good and jumped on it. I have stopped people in the mall who think if they're sitting in the mall, they don't have to wear a mask, regardless of the fact they're not in a restaurant. And I try to explain to them, no, if you're in a restaurant. And most people are nice, but some people are still very not as nice as they could be, not as kind as they could be. But it doesn't stop me. I'm enforcing the fire ban too for people who are smoking outside. It's something we know about and something we do.
Well, I think Bootsy Bellows has been hugely instructive. And if I owned a restaurant, if that didn't get my attention, I don't know what does. So hopefully they'll behave a little differently.
Krista, did I see your hand go up? And I see Tori's hand.
Yes, thank you. I'm sorry. I'm going to have to go pick up my kid from the school bus in a few minutes, but I just wanted to Greg's point earlier about the positive mental health messaging, because I do think this is such a stressful time, and either, there's so many things going on physically that the mental health definitely needs to be addressed too. And I mean, I'm new here, I'm new to the area for the past 3 years, but I just feel like these signs, even that I see going into Snowmass, that are like, mask up, blah, blah, blah. If we could even just put like funny things on there, or mental health things, or things about, because I think even small things like that, when people are driving in their car by themselves and they just see a message that makes them laugh, it kind of de-escalates this time of just stress and bad news that's everywhere. So I was just going to throw out some of that like positive mental health, and I don't know how we'd exactly accomplish it, but that's
Thank you very much, Krista, for that comment. And I'm glad your kids have enjoyed a day of school. Okay, Tori?
Yeah, I was hoping that I could get a little bit of clarification. I started a conversation with Karen yesterday about restaurant bar seating, and I still just am not that clear. I got a message from somebody today that was over in Vail, and they were sharing an account that they were having lunch at a place that had patrons sitting at the bar. And then the note started yesterday, as you remember, from Boulder County. I was just wondering, is the state guidance on restaurant bar seating changed, or anyway, that was the question. I just wanted to get clarification for a couple of the restaurants that are wondering about this new restaurant bar seating and its availability.
Yeah, Tori, my understanding, but the team is definitely much closer to this. So if there's someone on here that can answer better than I, but my understanding was that either the bar, the physical thing, can either be a place for someone to put, in essence, put the drinks on, and then someone picks them up and takes them out to someone seated, or someone can be sitting at that bar, but it can't be, you can't have both happening at the same time. So that was my understanding. I'm looking on the team to see if anyone has any clarifications for that.
Well, and Karen, the other thing that I would add is that at least in the original variants, I think Eagle County had sought a variance for bars and the safer at home. And I don't know that has changed. I think at one point they had opened bars. So this is one of the challenges with the variance process, where it changes by jurisdiction to jurisdiction. But I think we need to look at whether that might be part of that confusion, Tori. But for Picken County, as Karen was saying, it's governed by our public health order and the state public health order. And it is very clear that with the state, bars are not allowed to open until a community qualifies for protect our neighbor, really, unless there's been a specific variance granted.
But that means sitting at the bar? I thought the reason you couldn't sit at the bar was because of the proximity to the bartender. There's not a good constant 6-foot separation.
I just pulled up the CDPHE and it says only allow bar seating options if the bar is not being used for bar service.
Right.
And there's clearly separated sections of 6 feet. So that you can sit at a bar as long as it's not being used as a bar, it's being used as a restaurant and you're socially distanced.
Mm-hmm.
Thank you for that. And then Karen, I had another question for you. For the compliance questions, who would I direct people to if they're trying to put in a business safety plan and try to get operating again? Is Jordana? Does Jordana?
Yeah, so that we have the portal within the website. So to submit those, so the submission of the event safety plan or the business safety plan is actually a portal in there, but we have a website for compliance. So there's two different things going on here, and so we have I can't tell you what it is off the top of my head, but I will send it to you. We have a general email that then goes to compliance. So there's 3 different things. So there's the submission of those plans.
Yeah.
There's a submission of a complaint, and then there's the general email that goes to that whole team, and then they kind of sort through it. So I can send you that email.
I think I just got it.
It's business safety plans. The link is you just click on business safety plans and it pulls it up. Different categories and everything. And it's actually pretty efficient to do because I've directed a lot of people there.
Okay.
Suzuho just did post all of those things in the chat. So yeah, thank you, Suzuho.
Thank you, Kara. Okay, thank you. Thanks, Karen.
Okay, any other items for round robin? I will share with you the #1 issue this morning at the Snowmass Rotary golf outing here at the club was Bootsy Bellows. That was the talk of the town, or talk of the golfers. So, yeah, people have not been overly happy. So that's my reading on the spectrum of my meter of what's hot. So just so you know. And we'll let the legal process work its way through. Greg?
Yeah, thank you. That too is also those are the raised eyebrows. Just the hearing that the vote from the board was a little bit of a surprise. So it'll be interesting to drill into that when the news comes. I have been hearing from people who still say it's really hard and they don't understand the testing process. So I did send a note to Karen earlier about the possibility that we might consider establishing an ombudsman or someone who can help someone through testing, just a local testing process, how to do it. It occurs to me that if you think you have COVID and you're stressing out about that, it gets pretty hard to go in and fill out the paperwork, and the paperwork isn't always easy, and it might be a good idea to make the process easier, and maybe an ombudsman, or I think Karen had a different term for someone who could help people with the process might actually be useful, because I still get emails and calls from people who are exasperated or frustrated with, and confused. So I just wanted to throw that out, and I think that'll come up in a future conversation.
Thank you very much, Greg. Any other member of the board want to participate or bring up an issue for round robin? If not, let's look towards our next meeting, which will be 2 weeks from now. Today is September the 3rd, so that would be 14 days, 17th. Is that correct, Karen? September 17th?
Yes.
And by then, I'm sure we'll be heavy into more information on winter season, fall season and winter season planning. And we'll get updates from Suzuho, which I look forward to in terms of the Latinx Latino issue. And then, of course, our data, both from the hospital and from Josh. And we'll begin at that point to see what has happened as a result of Labor Day in colleges convening, and maybe some more, some changes coming from the state. Any other items for the agenda so staff can start planning? Pretty well cover them? Okie doke. If you have ideas of other issues that pop up in their interim period of time, please send over to Karen and team and copy me on it, so we kind of really know what's first and foremost in your mind. So, and I will carry, Greg and I will carry the messages over to RAFTA board meeting next week. That ought to be a very interesting discussion because winter planning is already on the agenda. So, do I have anything else to come before the board? If not, I'll entertain a motion to adjourn. Tom raised his hand. Motion to adjourn. Do I have a second?
Second.
Thank you, Greg. All in support, raise your right hand. Okay, see you all. Good meeting. Thank you, Karen. Thank you, team.
Yeah, thank you.
John, you travel safely back home, and don't get in any trouble as you come across.
All right. Thanks, Marky.
Keep monitoring what's happening in other states, because I think we've got a story here.
I agree. We're doing great. We really are. You should all be impressed with the work that our community is doing on this. So thank you all.
That is good firsthand news.
Yeah, and tell Gracie good luck.
Will do. Thank you.
Okay, take care.
Bye, everyone.